My practice is focused on individuals aged 55 and older because my educational background is for geriatric patients. Now, I don't consider people who are 55 years old to necessarily be old, but I do think that that's a key component of my practice because I can step in and help with prevention and start talking about illness earlier on. So I do enjoy that quite a bit. My goal is to provide people with the tools and the education that they need to help take care of themselves. And I understand that there is what we recommend, and then there is kind of what happens in the day-to-day way that people live. And I hope to find kind of a bridge between the two and work with people so that they can incorporate health into their daily life without it being so burdensome. Because I think when you show up in a practitioner's office and you feel like you're being lectured at, or somebody's trying to tell you how to live, there's a little bit of resistance there, and I really would like to see how we can work together to have the best outcome possible. I grew up in Rochester, Minnesota, with 3 brothers, and went to school at the College of St. Benedict. Graduated in class of 2001 and moved out to Colorado shortly thereafter. Worked at the University of Colorado for about 6 years when I decided to go back to school to get my master's, and studied in gerontology at the University of Colorado. I was fortunate enough to spend time with my grandmother growing up, and as I got older, I learned to appreciate her on a different level. She was a really interesting person, and I think kind of shaped a lot of who I am today. I enjoy listening to people's backgrounds and understanding where they come from to try to help them incorporate a healthy lifestyle into their daily living.
As an audiologist, my main role is to evaluate and diagnose hearing loss. That occurs through birth, through geriatric populations, and to help come up with effective management treatments for that. There is no cure for hearing loss, therefore we're looking at assistive devices, different devices, hearing aids, technology, to be able to assist that person to achieve the level of communication that they want to have with their friends and family. My interest in audiology started in college. I was taking a class in communication disorders, which includes speech disorders, hearing disorders, and I found that the hearing disorder portion of that interested me a little bit more. It's very common, it affects a lot of people. At that time, my grandparents, now my parents, and it's just a very interesting field that we're able to help people improve the quality of life by improving how they're able to hear. My practice consists of any range of ages, starting from birth all the way up to geriatric population. My main focus would be on more the adult geriatric population. Obviously, hearing loss is more common amongst adults than it is children, but we're happy to see anybody. Patients come to see us in a variety of ways. Either they're referred to audiology by, let's say, their primary doctor, their pediatrician, just because the patient has raised concerns, or sometimes the patient themselves will just take initiative and say, you know what, I'm not hearing as well, my family's telling me I'm not hearing well, it's time to get things checked out. As an audiologist, I can function very independently, meaning I can see patients on my own patients that were not referred from anybody else. But then also, a lot of our patients have other issues. So for example, a patient that we see with hearing loss may also suffer from chronic ear infections. Therefore, we work in combination with the ear, nose, and throat physician to manage their treatment. That collaboration happens a lot with our pediatric population. Obviously, we want that medical diagnosis as well as the audiological diagnosis.
I see all different types of patients here at the clinic, anyone from infant all the way in to their 80s and 90s. I manage all sorts of different types of eye disease, such as diabetes and glaucoma and macular degeneration. Specific interests, I enjoy doing contact lens exams, but overall I'd be happy to manage any sort of eye disease. Well, the most important part of me to my practice is patient education, so the patient can understand the disease that they have and the need for the specific follow-ups in the future, either with myself or with the primary care provider. Ophthalmology and optometry work real well together at our clinic here. I'm doing a lot of the pre and post-ops for surgery, as well as I manage certain types of eye disease with the ophthalmologist here, and specifically I do more of the contact lens examinations here versus the ophthalmologists. I grew up in Mankato originally, so I've known this community for a long time, and it's great to be back in this area, and I care deeply for the people that are in this community, and I feel real blessed to be able to do that. It's really nice for this to be my first practice, and I feel at home here, and I work with a great group of ophthalmologists here that have really helped me grow in my way that I care for my patients.
Well, I have a very wonderful history with the Mankato Clinic. I actually started in 1981 as an LPN, and with the clinic's help, was able to go back to school and get my Nurse Practitioner's license. And through that, I have the dream job. I do infertility, and I do OBGYN. I get to see pregnant patients, and I get to see women of all ages. I came to the conclusion very early on in my life that I wanted to work with women. I come from a really big family. I have 9 brothers. And I will tell you, working with women is a whole lot easier than working with guys. So decided I wanted to be in women's health, and was lucky enough to land my first job there and have been in it ever since. Infertility patients need a lot more, I think, constant involvement on our part as nurses or as providers. We spend a great deal of time teaching with infertility patients because I don't think a lot is known, or is known as much as should be, that helps actually couples conceive. I've had really good opportunities with the Mankato Clinic to have infertility patients for the last 20-some years, and we've brought about numerous pregnancies. In fact, we have over a couple thousand babies out there that are related to our program. And I approach them hopefully with an involvement of them in their treatment plan. And I think they like that. I think they like that well. We get to know them very personally, and I try to spend a great deal of time explaining things to them. We offer tremendous services that otherwise are not available in any of the communities around here. We do inseminations, we do donor inseminations, we do monitoring for IVF cycles that are done in the cities or at any other big reproductive clinics. And we can offer that and do that because the Mankato Clinic makes it possible for us. So we have patients that are actually able to do in vitro fertilization and yet do their monitoring and their testing all here at the Mankato Clinic. Success in my practice is when someone walks out the door and feels like they've had all their questions answered, and that they've had the time to ask those questions and to make a very informed decision about what's best in their particular situation.
I actually grew up in this area, about 40 miles in a little town called Louisville, actually on a farm outside of Louisville, and went to school in Truman for high school. Then in college, I decided to go to South Dakota for a year and a half, missed home, came back home, and finished my school at MSU for my nursing. And then after I finished that, I stayed in the area, went to PA school up at University of North Dakota, and then of course stayed here as well. So really have liked this area and have found it to be my home. As an RN, I always knew that I wanted to go the next step, and it was always kind of a decision for me to make. Do I go to nurse practitioner or do I do PA school? And I decided to go the physician assistant route because I do have the nursing background, and I think doing the PA route made me a more well-rounded provider because I have the nursing background as well as a medical school training and kind of mesh those together, I think makes me a better provider. Physician assistants can basically do almost all of your health care. There are very few patients that we don't see, or very few conditions that we don't see. We do collaborate with our physician typically that works in the same clinic. So mine is Dr. Odden, and we work very closely with patients. If I have any questions whatsoever about a patient's condition or haven't seen it before, he is my go-to, definitely. But otherwise, I can do pretty much any of your normal healthcare stuff, your hypertension rechecks, diabetes management, med refills, acute conditions such as colds, coughs, urinary tract infections, all of those kind of things. I can handle any of those without a problem. The Lake Crystal Clinic is really kind of unique because it is small. We are mostly from the community or the area, so we know our patients, even on a personal level, which is really nice. So we know what's going on in their personal life as well as their medical profession or their medical conditions so that we can be even more well-rounded with our care for our patients. I think success is a big part of collaboration with your patients. So working together with my patients is really important. I mean, I like to really explain why I'm recommending a treatment or a medicine, because if you don't understand why I'm recommending it, you're less likely to take the medicine or take my recommendation. So I really work really hard with the patients to discuss why we need to do the next step or why we need to do this kind of treatment or why this medicine is recommended over that medicine. So it really becomes a team approach with my patients, and that I think is the most important part of healthcare, because if you don't buy into what we need to do, we're not going to be successful.
Well, I've been here for 4 years now, and part of the fun of being here is I get to work with this department of professionals who really do seem to respect each other a lot. And we even have a little fun once in a while. It's kind of a cool deal. And people respect each other's gifts, abilities. I think the trust is really high, that people trust me to do my job. I trust them to do their job. And so I get to see people and meet people every day and learn about their journeys. The people I serve, I really look at kind of a teach me approach. I want them to teach me what it is that has brought them this far in their life. I want to know some of their backgrounds, some of those stellar moments that have helped to shape them who they are. People who sometimes describe how they've had difficulties they've gone through, for example, or maybe even high moments that they've gone through that have helped shape them into who they are. And then they come to me and they've been stuck in some way, gotten stuck somehow. And so I want to understand what it is that they know about that. I want them to teach me what they've tried already to get unstuck, what they're looking for, what they're trying to do differently in their lives. And so it's this constant learning process for me in which I get to connect with people where they are on their turf. I'm really looking forward to even refining the art of therapy even more. I find that the art of connecting with people at the place where they're at is so exciting and so energizing for me. One of my favorite things to do is draw upon people's resiliencies. I'm always amazed at what it is people have gone through and how they've continued to live their lives in spite of the difficulties and the swamps that they've had to walk through in their lives. So I feel just so privileged to walk with them through whatever swamp they're in the midst of now.
Over 95 years ago, two physicians shared the same vision, creating a multi-specialty clinic in Mankato. This revolutionary idea launched the Mankato Clinic. Today, Mankato Clinic provides healthcare at 10 sites in 5 area communities. With over 115 providers, we offer primary care and over 20 specialties, like ophthalmology and sleep medicine, along with urgent care and express care. The Mankato Clinic, focusing on the health of our patients, right here, close to home.
I take a little bit of a different approach. A lot of times when people think they're going to come to a dietitian, they expect the dietitian to go over what they're eating and then just give them a meal plan. And that's not typically the approach I take. I really look at the person as a whole. I see them as a whole wellness perspective. I really look at the stress that's impacting their life, potentially relationships, work stressors, financials, and see how that's impacting their weight. Because oftentimes it's not just the food, it's everything else that's causing their weight to increase, because it could be they're emotionally eating, or they're just not learning how to cope with that stress. So I really try to get to the root of the problem so that we can bring them long-term success in the end. I went to school at Minnesota State University, Mankato, for 4 years. After graduating from there, I had to do a year-long internship in Illinois, in Peoria I went to. And throughout that internship, we do all sorts of rotations, both clinical in the hospital as well as outpatient. And that's where I really fell in love with counseling patients. We were fortunate to be able to counsel at-risk, low-income patients during that time. And that really gave me a lot of experience. But what brought me to the field of dietetics was my experience with weight and struggling with weight as a child. And so understanding really that connection and that relationship with food, and how difficult it can be to lose the weight and have people not understand that it's more than just food. So currently I do specialize in emotional eating and disordered eating, but I do see patients from kids all the way up to the elderly in all areas of nutrition. So it could be anything from Crohn's disease, celiac disease, eating disorders, weight loss. I also see patients for weight gain. They might be struggling with cancer treatment and some of those side effects, so with weight loss. I also see patients who have food allergies and need help with just really looking at the food labels and figuring out what foods can they eat on that meal plan. I work with a lot of patients with irritable bowel syndrome. We also see patients for kidney disease. So really there's a lot of opportunity for nutrition interventions. Diabetes is a really progressive disease. So the quicker we can work towards preventing it or prolonging it, especially at that when we start seeing patients developing prediabetes, the more likely we are to decrease your risk of getting that type 2 diabetes. And so that's where nutrition comes along. Nutrition is the foundation to prevention and the foundation to health. So if we can get you right away when we start seeing blood sugars come up, we can definitely prolong how quickly type 2 diabetes develops. And that's our goal. When you're in our office, we're looking to help you prevent those diseases. The best treatment for weight loss is really a collaborative approach. So it's talking with the provider, your family physician. It's also sometimes meeting with a psychologist and getting that behavioral counseling piece involved as well. So the more team approach that I take, I feel the more likely my patients are to have success.
At the North Mankato Family Practice Clinic, I am a care coordinator, and with that I get to see patients with chronic diseases, anywhere from diabetes is the main focus, but we're just spreading that to cardiovascular and asthma and really anyone that has that chronic disease. And my job is to help them manage that a little bit better. I visit with them during their visits, I check in with them afterwards, give them a little bit more one-on-one time with them so that we can do just a little bit more education with them while they're at the clinic. I set goals with them. Goal setting is a big thing for my patients, and it's not a goal that I'm setting for them, it's a goal that they have identified that they want to achieve and do through the year. And with that, then I include everyone in the team The providers are aware of the goals, the nurses, everyone is working as a team to help that patient achieve those goals. Nursing started out for me probably as a kid, wanting to become a nurse, helping people, helping my parents, always fixing those scrapes and bruises. And then I went to school here in Mankato and went for nursing, and I've loved it ever since and been in this area in this community doing nursing in some way, shape, or form. The care coordinator position for me was a great position because you were able to learn about your patients, identify with your patients, get to know them on a different level than just seeing them in the office and letting them go. I also like the fact that I get to do the education with them. Education is my passion, so I love to be able to do that education with them right there on the spot, or follow up with them afterwards on that, or get them to the appropriate resources for that education.
I was diagnosed with diabetes in 1993, and that was in Kansas. And I went through several treatment programs, and when I moved to Minnesota and got involved with the Mankato Clinic, worked with the doctor, and as we went forward, we changed my regimen, and I'm an insulin-dependent diabetic, which actually works for me as far as control is concerned. Not too long ago, I was called and said that there was a nurse coordinator that wanted to meet with me before my appointment with the doc, and so we talked about different things. And in the process, we set some goals, and we did some things that not only was part of the treatment program, but also got me involved with managing my own diabetes. I do a certain amount of self-management with my shots and some other things, but this was a thing to coordinate what I do at home with what the clinic is looking for, and so that's how I actually got started with it. I would say that it's a very positive thing for this reason, that the healthcare home I would recommend for anybody. And as a matter of fact, I would think that anybody with a chronic condition should be a part of this process. What it does is make you a partner in your own care. It's easy to go to a clinic, go to a hospital, and have them give you direction. And you go home with a sheet of paper that says, do these exercises, or do these things, or do these things. That's easy to think about, but it's hard to do. When you're a part of a team with your medical provider, what they'll do is give you suggestions on what you should do. Then they will help you follow up with that. Instead of waiting 4 months, let's not wait 4 months. Let's wait a couple of weeks. Give us a call back, and we'll check this out again. So it's a good positive thing, and it puts the patient, me, more in control of my treatment and the things that I need to do to manage my diabetes. And if I have to report back to someone, then the idea is that I will be more diligent in knowing that if I've got to keep track of this stuff, then I'm going to have to show them good numbers when I go back, or they're going to wonder, what have you been doing out there for the last 6 months? So, yeah, it's a good tool to keep me focused, keep me engaged with my own treatment.
I'm from a small town in southern Minnesota, Sherburne, and I went to school out in South Dakota, but always had a passion to come back to Minnesota and continue to do care here. All of my family is here, and just wanted to be close to them. I'm a family person. I guess nursing started for me with my grandparents. Both of them had quite a few hospital stays, clinic visits, and I started noticing that it wasn't the doctors really taking care of them and asking them how they were doing. It was the nurses, and that's what got me interested in what they do as a field and what their profession is, and from there I just knew that that's what I wanted to do. So when I started nursing, I started in home care as a case manager for kids who had complex needs and they needed nursing in the home. And my job was to make sure that nurses were available for them, that they were trained to do the things that they did. And then when I took the role at Mankato Clinic, it helped broaden that in seeing how the clinic helps case management in the home. And my job here now is to coordinate the care between the provider and those home care agencies. And then with that, I also screen the entire population and look for where we can do better as a clinic, where we can improve our diabetes care and our care for those complex needs kids, and also where we can help improve the population health as a whole for our kids. So when a patient comes into the clinic, they're identified by either the nurse, the provider, or myself as someone who could possibly benefit for care coordination. And so with some of the providers, I come in at the end during the entire visit or sometimes at the end of the visit, and I just talk about my role and how I might be able to help better serve them, whether it's getting them connected with community resources in the area or coordinating between our providers and outside providers, or it could be coordinating between a dozen different organizations, maybe a home care, our providers, outside providers, and what my role is. And then we talk about healthcare home in general and what the state or what healthcare home, what we're doing at a local level and at a state level, and how they can foresee their care being here and broadly. So healthcare home is a team collaboration between the provider, his nurse, and myself and the patients, or their patients and parents. And together we come up with what are their goals. Maybe not necessarily health goals that they can see right away, but goals that will help them either stay out of the hospital or help them at home with the things that they can do at home to keep them healthy. And we support, and then the providers and myself and the nurses along with the parents help support those goals. So the whole picture for the clinic is we will be expanding the care coordination role, and right now there's just the 3 of us. But it's exciting because we'll be able, especially in the pediatrics department, as a child grows, we'll be able to help transition from pediatric doctors to those family practice doctors, and with their care coordinators as well, they'll be able to make a nice handoff, and parents will feel have that support through the whole process, and there won't be any gaps that are left behind and questions left behind.
Over 95 years ago, 2 physicians shared the same vision, creating a multi-specialty clinic in Mankato. This revolutionary idea launched the Mankato Clinic. Today, Mankato Clinic provides health care at 10 sites in 5 area communities. With over 115 providers, we offer primary care and over 20 specialties, like ophthalmology and sleep medicine, along with urgent care and express care. The Mankato Clinic, focusing on the health of our patients, right here, close to home.